The reverse total shoulder, or the reverse shoulder arthroplasty, is a surgery that's designed primarily to treat a condition called rotator cuff tear arthropathy, which is a special kind of arthritis that we see in patients that have had long-standing chronic rotator cuff tears. Now, the indications have expanded in recent years to include certain kinds of fractures, but the main use is with a long-standing chronic rotator cuff tear. And so the shoulder is a ball in a socket, like you see in this model. The socket is made up of your scapula, your shoulder blade, and that part of your scapula is called the glenoid. The ball in the socket is the top of your humerus. That's the humeral head. And what happens with a long-standing rotator cuff tear is that the humeral head, the ball, starts to migrate or move in a superior fashion, or up, if you will. And the problem with that is this bone, which is called the acromion, the humeral head, after a period of time, will start to hit the acromion, and it's not meant for that. There's no cartilage lining that area, and it's quite painful. And then the other thing is the patient starts to develop arthritis on the very top part of the socket. And so it's the mission of the rotator cuff to hold the ball in place, and so if you don't have one, again, what happens is the head starts to go up this way. And so in that setting, once it reaches a certain severity, after we have maximized non-operative treatment, physical therapy, cortisone injections, anti-inflammatories, activity modification, once those have been all exhausted and the patient is appropriately symptomatic, meaning, frankly, they're quite miserable. They have difficulty sleeping. They have difficulty doing what we call activities of daily living, washing themselves, caring for themselves. Once we get to that point, we have the discussion regarding a reverse total shoulder. And what that is in a standard total shoulder, what we do is we replace the ball with the ball and we replace the socket with a socket. Well, in the reverse situation, what we do is we put the ball on the socket side and we put the socket on the ball side. And what that looks like is it looks like this. So now on the shoulder blade, or the scapula side, you have a ball, and now you have a socket on the opposite side. And the brilliance of that, the beauty of that, is that you don't need a rotator cuff anymore. The construct, the design of the implant, holds the socket in place, and you use your deltoid to raise your arm, along with some other accessory muscles. And so that's how the reverse total shoulder works. And it's a very effective operation. It's done through the exact same incision as a standard total shoulder in the front of the arm. The operation takes about 90 minutes to 2 hours. Patients in the hospital for between 1 and 3 nights. I usually have patients in a sling for 2 to 3 weeks, and then you come out of the sling. It's a quick recovery. The satisfaction, patient satisfaction is very high in the appropriate indications, and it's been shown to be quite durable. We've been doing these in the United States since 2004. And in Europe, they've been doing it for several decades. So it's a very effective operation for rotator cuff tear arthropathy, and the patients that I have done this procedure in have been very, very happy with it.